Hydrogen fluoride, also known as hydrofluoric acid. Synonyms and trade names of hydrogen fluoride are anhydrous hydrogen fluoride, aqueous hydrogen fluoride, and hydrofluoric acid. What is hydrogen fluoride? It is an inorganic acid, a colorless gas at room temperature, or can be a fuming liquid when at temperatures below 67 degrees Fahrenheit. It is shipped in cylinders. It's derived from the reaction of concentrated sulfuric acid on fluorspar. It's used for etching glass, the manufacture of glass, semiconductors, computer chips, and ceramics, rust removal, petroleum exploration, in dental laboratories, tile cleaning, and many other industrial applications. Talk a little bit about the exposure limits. Both OSHA and the National Institute for Occupational Safety and Health have a time-weighted average permissible exposure limit for OSHA and a recommended exposure limit for NIOSH, and they're both 3 parts per million. NIOSH also recognizes a ceiling recommended exposure limit, and that is 6 parts per million. American Conference of Industrial Hygienists threshold limit value is also 3 parts per million, and NIOSH immediately dangerous to life or health concentration is 30 parts per million. Exposure routes and symptoms. Exposure routes can include inhalation, skin absorption when in liquid form, ingestion as a solution, and skin and/or eye contact. Some of the symptoms of exposure are irritation of the eye, skin, nose, and throat, pulmonary edema, eye and skin burns, rhinitis, bronchitis, and bone changes. It should be known that swallowing only a small amount of highly concentrated hydrogen fluoride can be fatal. Also, inhalation of hydrogen fluoride at high levels can cause death from irregular heartbeat and/or fluid buildup in the lungs. Small splashes of highly concentrated hydrogen fluoride on the skin can also be fatal. Some of the results of exposure. Dermal exposure can lead to tissue destruction or necrosis, which is the breakdown and decay of the cells. Ocular exposure can lead to rapid pain, corneal abrasion or ulceration, scarring, and permanent visual deficits. Ingestion can cause gastrointestinal burns, painful lesions, hemorrhagic gastritis, and pancreatitis. Inhalation can lead to dyspnea, bronchospasm, chemical pneumonitis, pulmonary edema, chemical burns, and respiratory failure. Chronic exposure over time can lead to weight loss, malaise or feeling ill, anemia, leukopenia, discoloration of the teeth, and osteosclerosis, which is unusual hardening or high density in the bone. I have a couple of visual examples of what can happen when you're exposed to hydrogen fluoride. This one seems to have come from a case of ingestion. As we spoke about before, the discoloration of the teeth with chronic exposure. And it can of course lead to chemical burns. Recommended personal protection and first aid. First of all, you want to prevent contact with the skin and eyes. If you do come into contact, wash the skin and remove wet or contaminated clothing immediately. Irrigate eyes immediately upon suspected contact. Seek immediate medical attention if ingested. NIOSH and OSHA respirator recommendations are as follows. Exposure up to 30 parts per million. Recommended any chemical cartridge, air purifying full-faced, supplied air or self-contained breathing apparatus. For emergency entry, any self-contained, full-faced, or supplied air respirator, and for escape, any air purifying full-face piece respirator. I hope I was able to shed some light on some of the precautions that should be taken and some of the dangers you should be aware of when dealing with hydrogen fluoride. If you have any questions, don't hesitate to contact me, and I appreciate your time.